It's 8:18. Welcome back in. And this morning we're talking about back pain and some of the medical technology that is now available to you if you're to the point where you might need surgery. Dr. Andrew Cordover is a board-certified orthopedic surgeon at St. Vincent's in Birmingham. He joins us here this morning. Good to see you, Doctor.
Nice to be here. Thank you for having me.
Absolutely. So I know your practice there, they're pretty excited in your office about this new technology. First of all, talk about what the technology is going to be helping patients.
It's an assistant for surgeons. The robot itself does not do the surgery, but it's an adjunct, or it's an aid for the surgeons to do surgery that's less invasive, more accurate, and with hopefully better results than we've done traditionally. All
right, so talk about traditional surgeries and the candidates for back surgery, how that was addressed through prior procedures, and how this alleviates maybe some of the risk involved with the prior surgeries.
So traditionally we've done open surgery, and the push in a lot of medicine has been to do less invasive or more minimally invasive procedures. Smaller incisions, quicker recovery times, and instead of a traditional incision where we're peeling or removing muscles and bones, we can do this through much smaller incisions, again much more accurately, and again speed of recovery, less pain.
Okay. So now if somebody is out there and they say, well, I know I have a back issue, they don't know whether or not they're a candidate for surgery. Obviously they need to go see their doctor, but who would know, like when do they know I need to probably go get something done?
Well, the evaluation is very complex. 80% of the population can have back pain at some given time. Short-lived back pain is not something most of the time we need to worry about. One needs to start with an initial evaluation, sometimes an MRI, evaluate the pathology, see what's causing this problem.
Now, so the robot actually does the surgery. Then what are the doctors controlling what the robot does? Does it already have a pre-programmed thing of what to do on the person's body?
So the technology is just fantastic. In my 20 years of practice, this is one of the neatest things that we've been exposed to. The patient undergoes a CAT scan prior to the surgical intervention. In the operating room, when the patient's asleep, a fluoro machine is utilized to obtain a few shots. They merge the fluoro images or the X-ray images with the robot data that's come from the CAT scan. The robotic arm comes out and it directs us to the exact and most precise location to place the hardware. The hardware is used as an adjunct or to assist in spinal fusion surgery. Not all spine surgery requires a fusion, but when it does, that's when this device is utilized.
Right, so if somebody has a herniated disc, just using this as a hypothetical example, and just expound on the fact that how this may also help in terms of your recovery time actually being less than what it normally would be.
So again, with very directed surgery, with a robot there pointing us where to go, telling us the direction to go in, we can make smaller incisions. We can get people back more quickly. Again, less tissue destruction and speedier recovery.
So less chance for scar tissue issues that develop later where you have to have further surgeries then, yeah?
And less complications, more accurate hardware placement.
All right, interesting stuff there. Robotic surgery, we're entering a new age, that's for sure, into medicine. It's a good one. Thank you, Doctor. Appreciate it.
Thank you.
Absolutely. All right, still a lot more.